talked about the adaptations that we see if we do endurance training. So in the muscle fiber, the adaptation that we see to endurance training is more mitochondria. We see decrease in the diameter of the fiber so that it's easier to move oxygen, the diffusion distance is shorter. Right? Lots of increase in the enzymes that help work Krebs cycle and the electron transport chain. When we look at resistance training, we see an increase in the size, in the diameter of the fiber. So the opposite thing occurs then with the endurance. And we may or may not see an increase in the number of muscle fibers. There's some indication that these fibers split. When we're looking then predominantly at this idea of hypertrophy, that's how the muscles mainly grow, right? When I get bigger muscles, when I'm training hard, basically we're seeing hypertrophy, not increase in number, not hyperplasia. So we have two kinds of hypertrophy. One of them is transient, short-lived. If I go down the gym and I work out really, really hard, the muscles fill up with water and they look a little bit bigger at the end of the training session. So if you go to a bodybuilding competition, what you see backstage before they walk out is everybody is pumping as hard as they can with dumbbells and things so that when they walk out, the muscles are as full and rounded as possible. Right? That's very, very short-lived, transient hypertrophy. Right? It's all about moving fluid into the muscle tissue in response to a single bout of exercise. Right? Give it an hour or so after training and that's gone away. It's not permanent. I can't go down the gym and lift for an hour and get bigger. Right? That's it. It doesn't matter whether you look bigger, you're not. It's just arbitrary, right? It's really short-lived. The other type is the one we're really after. We want chronic hypertrophy. So we want long-term increase in muscle size, which leads to increase in strength. So chronic hypertrophy is what we're aiming for with a training program, with a resistance program. Okay? So when we see hypertrophy like that, we don't get, similar to what we talked about with the endurance training, I'm not turning type 1 fibers into type 2 fibers. Okay. I don't use these very much for weightlifting, so I don't see as much adaptation in them. What we do see, if you're doing reps, so if you're doing like a fitness type workout, we'll see some change of X's into A's, because these are my real high power ones. So unless I'm doing very heavy, short rep type work, these aren't going to be as useful as these. I'm going to do a set of 15 or a set of 20. I'm going to be using 2 A's. So there's minimal change between the fiber types, remember. If I am built a type 1, I can't make those fibers into a type 2, and vice versa. So if you're working with competitive athletes, then you're going to use the rule of specificity to decide what your ratio of your training program should be. How much of it should be aerobic versus how much of it should be anaerobic. Right? One of the questions we get with certain types of athletes, and particularly when you start looking at the regular population, is, well, what if I want to do both? Right? All the health guidelines say I should be physically active, I should do 150 minutes of aerobic exercise a week, but it also says I should be lifting twice a week. Right? Well, so how does that work? What's going to change? What adaptation am I going to see if I'm trying to do both aerobics and weight training at the same time? Okay. So, when we look at the studies that are run on concurrent programming, so I'm looking at someone that I am programming endurance work and resistance work. Okay. Then what we see in most of those studies is that the strength measurement can be decreased when I include the endurance training as well. If I do the strength training just on its own versus the strength training with some aerobics, we see less strength gain from the program.
Is that vice versa too?
Sorry?
Is that vice versa too?
No. We'll get to that in a minute. Good question. No. Power then, because power is strength times the speed of contraction, we also see power compromised. And there's some indication in the literature that actually power is even more compromised than just strength on its own. Okay? There's some lack of understanding as to why we see that happen. Mostly people are going with the idea that it's probably due to overtraining. If I am trying to do a strength program, then I've got to be in the gym quite a lot, right? And if I'm trying to do an endurance program, I have to be running or biking quite a lot. So chances are that this individual is training too much over the course of 7 days and not taking enough rest days or any rest days. Right? They may have decided that they're going to go to the gym Mondays and Tuesdays, do a split program, run on Wednesdays, run on Thursdays, do a split program Friday, Saturday, run again on Sunday. Right? So now they're training every day of the week, they're not taking a break, and so the drop in the strength measure may be due to overtraining. But no one has pinned it down exactly yet. So anaerobic performance then, activities where anaerobic ATP production is predominant. So my jumping, my sprinting, then I'm seeing a decrease in the performance in those activities if I'm trying to do a big endurance training program at the same time. So if I'm coaching and the performance is the key, then I don't want my anaerobic athletes doing tons and tons of aerobic work. We said that already. The specificity, right, we've got that chart. The specificity is, well, I can't remember which one. Football was like 75% or 80% anaerobic and only 20% aerobic. So if I'm doing 40% aerobic training with my footballers, then the chances are their performance will drop off because it's not the appropriate form of training and endurance work impacts strength and power. Now, when we look the other way around, we don't see that problem. Right? If I am an endurance athlete and I do weight training, it doesn't impact my endurance performance. So if I'm a runner and I go lift, that's not going to cause me a problem. The only thing you've got to be a little bit careful about that way around is muscles heavy. So are you doing a strength program or are you doing a muscle building program? You don't want to be doing a size program because that's going to make you heavier and then you'll increase your injury risk when you're running and it will slow you down. Okay. So the caveat to this information is that when you look at the range of studies, the longest time they look at is around about 12 weeks. So they look at combining endurance and resistance training for up to 12 weeks. So then the question is, well, what happens if I do them together for 6 months? Do I start to see strength improvement again if I'm keeping it up for 6 months? We don't know the answer to that because no one runs a study for 6 months, or at least they haven't published one yet. Right? So the takeaway message is my strength and power are going to be affected by endurance training, but my endurance work isn't affected by my strength training as best we know it at this point in time. So when I'm writing a prescription, whether it's a training program for an athlete, whether it's an exercise prescription for a family member, then I've got to think about what's the overall goal of the program. So the goal setting idea comes back. Right, at the beginning of the semester, I said we're going to talk a lot about goals. It's really important. I have to know what the goal of the program is to write the correct program to achieve that goal. You can't just say, oh, well, I'm going to start training and let's see what happens. That's not very effective. You've got to make sure when you're writing these programs that you build in adequate rest periods. So we're going to use a periodization type idea. I'm going to build up intensity and volume, and then I'm going to have a rest day once or twice a week, and I'm going to have a point in time in the month where I'm working out at a lower intensity than the rest of them, right? I can build that rest in within a week, within a month, within a quarter, within a year. Strength and power athletes, the other take-home message is that if I'm working with an athlete who's a strength or power athlete, shot putter, sprinter, football player, baseball player, basketball player, then they should not be doing high-intensity aerobic work. Okay? I want to make sure that they need to do some aerobic work. Most literature would not suggest that you did none because there's an aerobic element to most games. It's just minimal, right? So I'm going to do some aerobic work, but it shouldn't be high intensity. So I don't want to be changing fiber types around in an inappropriate way for the athlete that I'm training. When you look at the diameter, when I'm looking at what happens to that diameter, then if I'm doing only strength, both type 1s and type 2s get larger. Okay? So I'm going to see more adaptation in the type 2 because they're the ones that are doing most of the work. Doesn't mean the type 1s are turned off, they're not doing anything at all. They're just not working as much. So I still see a little bit of adaptation in my type 1. If I do only endurance, then type 1s get smaller. Okay. If I combine them, what do we see? Right? What we see when we do a combination, if I'm doing running and lifting, then we see just our type 2s get larger. because these two kind of cancel each other out. All right? Clear-ish as mud. All right? Clear as mud. So it's just another piece of the pie, right? Where the adaptation is going to be positive for the thing I'm training for. So part of the problem is when I combine them, then I'm confusing the system because I'm asking it to be good at two things. So that's okay if what we're looking at is a health scenario, because as a healthy person, I want to be quite strong and I want to be quite fit. But if I'm looking at an athlete who has to compete at a high level in one or the other, I don't want to play around too much with the adaptation in the system that's key. Okay, question. No? Easy? All right. I know, it's Friday afternoon. Hang in there. It's almost over. And the sun is shining. It'll be all right. It's going to snow on Sunday, so make the most of the sunshine this afternoon and tomorrow, because then it's going to be freezing cold again for a few days. Okay? That would be interesting, because there's currently snow forecast for Sunday and Monday.
Yes.
So, I don't know.
Just cancel it right now.
Yep, they should cancel, right? I'm with you. They should just cancel school. No, I suspect that we may have a little bit of delay Monday morning if there's quite a bit of snow, but I doubt if they'll cancel the whole day. All right, so chapter 4, I'm going to make a little start on chapter 4 and then we'll pick it up on Monday, okay? Remember to look at the objectives, compare them back to the ones at the beginning of the chapter so that you're concentrating on the crucial stuff for this class. And in a similar vein to how we tackled muscles, I'm making some assumptions on your understanding of the structure and anatomy of the nervous system. Right? So, if you're a little bit rusty on that, this weekend I would go back over and have a look at it briefly, because it'll make this easier to follow if you're not lost in the mass of where the nerves are and what they're called and what part of the nerve we're talking about. So, primary function of the nervous system, it's a communication system. Right? It's the way that all organs in our body communicate and send messages to maintain homeostasis. Right? Homeostasis is the ability to maintain a quite narrow range of physiological environment. Right? And we've mentioned a lot that in the muscles, for example, when we create acid making ATP, that acidic environment slows down the enzymes and we don't make ATP as effectively. Right? Well, we've got lots more systems than just our muscles. And we have to maintain all the systems within a quite narrow range. Humans are not very tolerant of big fluctuations in how the systems are working. So, let's see. Exercise then is a stressor to the body. Typically, we consider exercise a very positive stressor, but there's a point in time where it will become negative. So when we're looking at overtraining, that's a negative scenario. But even when it's a positive, when I'm doing moderate levels of exercise for health and wellness, or I'm reasonably fit as an athlete, we're still, every time we exercise, we cause stress to the body. What happens when you go down to the gym and you've got a t-shirt and a sweatshirt and a cardigan and a hat and a pair of gloves and you start running on the treadmill? Okay, what are you going to do? Perspirate. Why?
Because a lot of running, so heat your body, generate body heat.
Body heat, right? So, we generate a lot of heat when we exercise, okay? And heat is a bit of a problem. It's a problem for our enzymes, but it's also a problem for other organs, okay? So, think about the last time you were sick. Temperature should be, on average, somewhere around 98.6, right? What happens when it hits 100?
Chills.
How do you feel?
Cold.
Cold? Feel good? Strong? Feel a bit crappy, right? What happens when it hits 104? Right? You feel really crappy. 104 probably doesn't kill most people, but it's going to make you very, very, very unwell. Right? 106, that's a bit dodgy. Okay? So, heat is one of those factors in the environment that we have to try to maintain within a very tight range. We can't get too cold in our core. We don't tolerate that very well, and we don't tolerate too much heat buildup. So we have to have a communication system that can let the brain know there's a problem here, fix it. So we perturb lots of systems. Okay? We've already talked about our pH. We've looked at temperature. Hydration is another problem, because when we exercise, we start to dehydrate a little bit. We sweat a lot, right? We're breathing faster, so we're losing water through our breath. And so we've got to have a mechanism to remind us that we should be drinking something. Our blood pressure changes when we exercise. So I've got to have a way of bringing blood pressure back to normal when I'm not exercising. Right? And blood glucose levels change dramatically when we exercise. And again, it's not the change that causes too big a problem, but without the ability to put the change back to normal, that's the problem. So we have to have this way of reversing the things that we set up when we exercise. We need a really well-functioning nervous system to deal with all the challenges, all the stress that we apply to the body. So communication then works in a couple of different ways between the nervous system and the organs. So from my stomach to my brain via the nerves. I can have either a positive feedback loop, which is the most common type that we see in the body, right? And a positive feedback loop intensifies something that's going on. So when we increase acidity during exercise, that stimulates blood flow. That should say blood flow. That's a typo. The increase in acidity gets signaled to the brain. The brain says, well, we can't have the acid sitting there. We need oxygen. Because if I've got oxygen, I don't see big acid builds up. So the brain increases blood flow to try to help with the acidity problem. That's a positive feedback loop. It increases blood flow rather than decreasing blood flow. Negative feedback loops reduce the intensity of a process that's going on, so they damp it down. So increased body heat triggers sweating because we see increases in temperature. We don't want to keep increasing temperature, we need to cool the body down. So the sweating is a negative loop because it helps to cool the body via evaporation. We don't want to overheat. Overheating can kill people. We read stories all the time. People die because they've been exercising in the heat, particularly when they've allowed themselves to get dehydrated. So, on a simple, if I'm looking at it really simply, all right, then whatever system I'm looking at has a rest phase, right? What are the levels of X in the system when it's at rest? Then we exercise. Okay. What we need is to come back to rest. But when we stop exercising, does our body temperature immediately go back to 98.6? Right? Takes a while. So we have to have the concept of a recovery phase in here before we can get back to rest. The recovery phase is the interesting bit for us, right? Because this is the thing that when I'm training, what I'm trying to do is reduce how long it takes me to recover. Right? Next week in lab, next week? Yes. Next week in lab, you're going to do a step test, and you'll be looking at heart rate recovery. The fitter I am, the quicker my heart rate returns to normal. So when we're training, what we're trying to impact is this recovery phase within a system so that we can get back to rest so that we can challenge the system again. What I don't want to keep happening is keep going backwards and forwards here, right? Because sooner or later something's going to break down. What I want is to be able to rest, come back to rest, cool down, get my heart rate down, and then challenge it again. Make sense? So, typical neuron. Neuron's just the fancy name for a nerve cell. Okay. Typical looking neuron. There's lots of different neurons in the body. The ones for muscles don't look the same as the ones for your heart or for your brain. But all neurons have a cell body. They all have dendrites. They've all got an axon. Some of them are short and fat and squat and have lots and lots and lots and some, right? They might not all look identical, but they all have these elements in them. Particularly when we're looking at motor nerves, one of the things we're interested in is the myelin sheath on the motor nerve. So the axon and the dendrites and the cell body can all vary in size and length. When I'm looking at a motor nerve, that axon has to come from the spinal cord out to wherever the muscle is that it's going to impact. So what we don't see is, here's the cell body synapsing in the spinal cord. it doesn't synapse with another neuron, and then another neuron, and then the muscle. If this is the motor nerve, this is the muscle. Right? So, think about if I have a 6-foot basketball player, 7-foot basketball player, then the length of the axon for the motor nerve that moves his foot. A bit longer than mine, right? But, so this axon can be short, can be very, very long. I've got to get information all the way down that axon to the muscle. So what we're going to look at next week is how do we get the information down through the nervous system to the muscle. What's the mechanism that allows that signal to travel to the muscle? Because it's got to go a long way and it's got to go quickly. Let's see. So we're going to be looking at what we call action potentials. Action potential is the stimulus, it's the signal. It's a piece of electricity that is going to travel down this tissue and send the brain's request to the muscle. Okay. So muscles and nerves are what we call electrically excitable cells. Right? They're able to carry a charge. All right, so we're going to look, this is kind of structural stuff, so we're going to go through this quickly. Okay. I've got 2 functioning different types of nerves. I've got a sensory nerve, which is going to take information from a receptor to the central nervous system. So the cell body is outside the spinal cord. They're also called afferent nerves. Which one is afferent? Okay. We have motor nerves that are responsible for carrying the messages in the other direction from the central nervous system to the muscle. And the cell body for those is inside the spinal column, and so the axons are very long. Motor nerves are called efferent nerves. We go back to our basketball player idea. Then this long axon has to go from his spinal cord. Right? That's where the cell body is. Out through the spine, down the back of the leg, all the way down to the foot. We also have a term that we're going to talk about next week, interneurons. Okay. And an interneuron is a little short cell. When I'm looking inside, do I have a picture of this? No. When I'm looking inside the spinal column, then we don't have just a piece of spine. When I'm looking inside the spinal column, let's say the signal's coming down from the brain. Okay. And I've got a motor nerve that's going to a muscle. I'm really bad at drawing. Okay? What are the sensory organs we've discussed in the muscle that's going to send signals back to the spinal column? That's the nerve cell. Well, there's the sensory organ. We talked about 2 types of sensory organs. This is a type of nerve. Sensory nerve or a motor
Sensory
nerve?
organ.
What's the organs that we talked about in the muscles that send information back to the spinal column?
What is this? I know what that was. Give me the letter.
One of them lays in parallel to the muscle fibers.
Spindles.
Ah, very good. Spindles. All right, that's one of them. Muscle spindles. What's the other one? It's the other one that lays at the junction between the muscle and the tendon.
Fibers. Goji. Goji.
Hurrah! All right, we got there. Well done. Okay, so those sensory organs are going to send information back from the muscle back to the spinal cord, right? So they've got a nerve that is going to carry information back. So I have a motor nerve, I have a sensory nerve. When we're looking at a reflex action, we said that that signal from the sensory nerve doesn't have to go all the way up to the brain. It can loop around in the spinal column and cause the muscle to contract or relax. Remember that? So, if the signal from here is going to send a signal here to contract or relax, there has to be some communication between here and here. Does that make sense? So, there's a little short mini nerve, right, that synapses with both of these, called an interneuron, and it allows the sensory system and the muscle system to talk to each other without going all the way up to the brain. Right? So it works like a little bridge. So an interneuron is a bridge between the sensory and the motor system. Yes? Helps us to fine-tune our movement control, because it means I don't have to wait for the signal to go up and another signal to come down before I can tweak what's going on in the muscle. Done? All right. So, really truly, it is important that you have some concept of your AMP nervous system if you want to cope with next week. So, take at least a brief glance at it, go back to your notes from AMP or have a look at the chapter, remind yourself what is going on in the nervous system.